Good morning.
Good morning. How are you doing?
I'm well, thank you. How are you today, Katherine?
Thank you. Looking forward to this.
Yes, always lovely to chat to you, and it's a nice way to start the week.
Definitely. Yeah, lovely way.
Yeah. Oh, it looks nice and sunny where you are as well.
Yeah, it is. It's beautiful. It's definitely a chillier today.
Yes, it is. So let's go straight into it.
Yeah.
We obviously share this recording, so anyone watching this will be able to see what we've been talking about today, a really important topic. But please introduce yourself and kind of share all the hats that you wear.
Lovely, thank you. So I'm Katherine Whitby, and my background is that I am a registered nurse, paediatric nurse. Continue to work in a paediatric A&E department in London, where I've worked for 25 years, and I've actually been in the NHS 30 years this year. I'm also a registered health visitor, a maternal wellbeing practitioner, and a baby massage instructor. And I'm a mum of two myself, and I started Baby Steps next year will be 20 years. So alongside NHS work, I offer courses, events to really give postnatal parents extra confidence, reassurance and peace of mind. And I do those in person, either in their home for just one-to-one or with friends and family, or I have a lovely studio here in the woods. I'm on the Hampshire-Surrey border near Hazelmere, and I run weekly classes. I've literally just got a class starting in an hour. I've got a 5-week baby massage course and then a lovely 6-week soulful mama course, which is all around matrescence and the different transitions that happen. Massive transitions that happen when you become a new parent. Today First Aid for Weaning has become a huge part of my work, because although I've always run first aid courses, I've always run weaning courses right from when Baby Steps started nearly 20 years ago. Really, it's always been the main reason my parents have booked my first aid course is worry around choking. So particularly as they start to think about weaning, also to get mobile at that point, and everything goes into the mouth. That's a completely normal stage of development, whatever they find, whether it is their toys or teething stuff, or whether it is just literally what they find on the floor, it all goes into their mouth. And because weaning has changed in a generation, so previously babies would be starting weaning much younger and just have kind of baby rice, baby cereal, something very soft. Because the advice now with weaning is around 6 months, as it has been since 2003, parents feel quite nervous, because obviously it makes a lot of sense to offer babies food that they can hold, they can chew on. You move quicker into kind of lumpy food, textured food. And when you've only just been giving your baby milk, that can feel quite nerve-wracking. The whole combination of, grandparents possibly giving advice, which isn't wrong, but it's not as up to date, obviously, as what we're doing now. But also the massive overwhelm of social media has become beyond anything I've ever seen in all the time I've been, working. Parents seem to turn to TikTok, turn to Instagram often for advice. And ultimately that advice can be by anybody. It can be misleading, it can be confusing, it can be conflicting. And once your algorithm picks up that you're weaning, it goes into overdrive with choking videos and allergic reaction videos, and do this weaning this way, and parents can start to feel very nervous about that. But also with weaning, that they're behind or they're not meeting expectations, that kind of stuff. So it's become quite a big part of my work, just to really try and put realistic expectations out there and very practical information to give parents the confidence they need.
Yes, yeah. I know personally it was the thing that I was most worried about. So hopefully that will mean that this will give people reassurance. And maybe we'll start with that, because it is a scary topic. And I know you do so brilliantly at calming families' minds about all the different things you cover. So maybe should we start with something like reassuring about weaning and how actually babies are built for learning how to eat as well, and
definitely. I mean, I think it's one expectation I'm actually trying to put out there as clearly as possible, is that babies do need to learn to eat. And I think something that parents are seeing, babies on TikTok or whatever chewing on a piece of steak, and then parents really worry their babies are behind. I get emails, WhatsApp voice memos of parents saying, oh, we're not doing very well, they're really behind. And I'll say, how old are they? Remind me how old they are. And they're maybe only 6.5 months. So they're right at the beginning of weaning. And although, they are putting everything into their mouth, they're doing that as a learning about the world, their development, and also to soothe teething.
Yes.
But actually taking a bite of something, chewing it down with their gums and swallowing it is completely different. And that process can take them weeks. It can take them weeks to understand that what you're offering them is actually food. So of course you can be giving some stuff on the spoon, and if they're happy to be fed by the spoon, they will take a little bit of that. But again, it might only be small amounts. And often babies will be very frustrated if they've just been neatly spoon fed. So they'll want to have a spoon that's loaded up a bit like a lollipop that they can like lick, chew and suck on. They may also want to have some finger food, and finger food is basically any food that you can give them in a kind of wedge that they can hold. It can be anything at all. So as much as possible, we're just trying to encourage parents to just look at their family meal. They don't need to spend hours and hours making tiny portions of things, and but having the freezer packed full of stuff. It's always good to freeze stuff. That's a massive tip to save time. Make double and freeze some, but freeze a family size portion, and then really with your meal each day, although they may not necessarily be having exactly what you're having, they can have bits of your food, and just gradually building up, because that's how, if a baby's having food that doesn't really resemble family food for quite a long time through their weaning journey, that whole thing, parents worrying about fussy eating and will they eat this, will they eat that, if their food doesn't really resemble family food, they're not really working towards that. So as much as possible, it's just adapting your family meal. It saves time, and it really helps them progress one meal for one family.
Yes. So why don't we move then on to let's start with the kind of gagging and choking and what people could expect.
So I work in A&E, often in triage, when parents first come in, and we really commonly see parents rushing through the door, really worrying that their baby or toddler has been choking. And actually, when we calm things down and listen to what's been going on, the reality is that the baby or toddler or child has been gagging, and particularly in those early years. Gagging is normal, and it's actually a protective normal reflex that we all have. We all have a gag reflex, but babies and young children's gag reflex is more prominent, and it's further forward. So as they're learning to eat and something hits the back of the throat that they've maybe not experienced before, the brain kicks in and thinks, is that safe? Is that not safe? And they will then do this loud dramatic cough. And that really actually, rather than being something scary, ideally parents can think of as something reassuring, because the body, the brain is doing what ideally we want it to do, and just checking in to see if that's safe. Now, as the baby progresses through different textures and different tastes, that will improve. So not every baby's going to gag loads, not every baby's going to do it every meal, but it's very unlikely to go through your weaning journey and not see gagging at some point. And gagging is a loud, dramatic cough. So if you've got noise, you're good, because that means the airway is clear, they're able to make that noise. And coughing is our natural way of getting anything out of the airway that shouldn't be there. We obviously can't tell babies and toddlers to cough. So it is really part of weaning. It's very unlikely any baby will go through weaning without some point gagging, and some babies just do gag a lot more than others. My second child, he gagged more than my daughter, and just kind of sat tight. As much as possible, where it's confusing for parents, when they coughed and spluttered on their milk, you kind of pop them over your shoulder and help them, or you have them sitting on your lap and you pat their back and just help them. Whereas once they're in the high chair and you're going through weaning, as much as possible, we're saying just try to encourage and reassure them, but sort of let them work it out a little bit themselves. Obviously, if you need to intervene, you need to intervene. But with gagging, you wouldn't normally, because they will just kind of clear it by coughing. So gagging. So if you've got a noise, you're good. And as much as possible, parents need to be confident with their first aid. So they're not diving in and hoiking babies out of high chairs and all of this, but just to be able to feel they've got that confidence. And the difference with choking is that it's likely that they would be silent, because something is actually stuck in the airways. So they'd be making very, very little noise, kind of, they wouldn't be able to make that noise of the cough, because something's stuck. And actual real proper choking, we all may know somebody that's experienced it, or their children have, or seen or heard a story. Obviously, we can Google and there's loads of stories. But actually, you know, gagging is a normal reflex. You're likely to see that on your weaning journey. Choking, hopefully not. So it's just being really, really confident and aware of that difference.
And how can you prevent, in terms of, you know, there are certain foods that you hear, things like grapes and sausages, that have been really in the media because that's obviously what's happened with. Are there certain foods that you would say avoid, or ways to cut them up, or anything?
Yeah, I think as much as possible, just it's kind of any sort of circular things. So you've mentioned kind of some of the key ones, things like cherry tomatoes, grapes, sausages, anything that you feel is just a little bit, you know, kind of a potential obstruction, and just chop things in half, quarter them. But I mean, I really wouldn't pinpoint any particular food, because obviously you don't want to not give that food, because most of them are going to be really nutritious.
Yeah.
You know, especially kind of the fruits and vegetables. Obvious choking hazards like nuts and things like that. Whole nuts you're not going to give. You're going to crush them or mill them or whatever. But the reality is, they will. You can read stories about babies and children choking on anything and everything. So I think it's just as much as possible putting them into the sizes and shapes that you feel comfortable with. When baby-led weaning first came in, sort of 20-ish years ago, parents and professionals as well were actually very worried about choking. So baby-led weaning is when it's just finger food. And actually what's shown over the couple of decades is that it hasn't increased choking at all, because babies are then just guiding and holding and chewing and sucking and licking whatever food they've been given. Actually usually tend to take massive bites and then sort of, you know, be at risk of choking. So I think it's just gaining your confidence, and the key way to do that is with a first aid course, because then you've actually got to go through it step by step. Some parents, I know, they just get completely overwhelmed with it. They start weaning, they get completely bombarded and confused with all the information. And I work one-to-one with families with what I call my weaning SOS service, which is where we break down the first aid into tiny microscopic sections. Parents can really visualize what's happening, because it gets to the point where they're just terrified to give their babies anything. They get, you know, worried at any point, whatever size the food is, what they're even going to give them, because they feel overwhelmed with actually what food to even give them. So then we talk about the actual weaning stage of where they're at, but also the kind of relaxation for the parent around that time. So first aid is key, but also the kind of environment, you know, making sure as much as possible you eat with the child, because that really does help to bring down the anxiety. Because if you're always feeding them one-to-one, just looking at them in the high chair, they're not getting that social enjoyment of weaning. Babies are very social, and also you feel more stressed because you're just constantly watching them and dropping things on the floor and smearing things, rather than just enjoying an actual meal together. So not any specific foods I would say to avoid. I mean, I actually was thinking then when we mentioned about sausages are processed, so you're not going to be giving those as a, you know, till they're quite a few years anyway. Yeah, as much as possible, just chopping things into sizes that you feel comfortable with.
What about things like jelly? Sorry. I know jelly's, again, probably not something you're going to give to a very, very young.
No, when they're older.
It's just something that I've heard.
Yeah, I mean, again, you hear about, you know, popcorn and all these different things will pop up, and of course it does make sense, but then you just break things right down, just make it very, very, you know, jelly, just sort of smush it, popcorn, smash it. But again, these things are, you know, not your day-to-day foods, because as much as, I mean, we're talking about real life here, so of course they're going to go to parties and you're going to have picnics and all the rest of it, but they often tend to be the foods that, you know, are going to be those sort of occasional foods anyway, rather than your everyday foods. That's the difference between gagging and choking. And then it's just really, really important to know your choking technique. And I have got the mannequin. Would you like me to run through that?
Yeah, that would be fantastic. Thank you. So I'd always also recommend going to a full first aid course, but if this can help.
Yeah, of course. So I'll position myself in a second so that you can properly see. But obviously, if they're in the high chair and it's gagging, you're going to just gently reassure them, and hopefully that will resolve. Babies, weirdly, are not that bothered by gagging. You know, they just are kind of eating their meal, have a bit of a massive cough and then just sort of carry on. It's the parents and those looking after them that are feeling nervous. And if you've got grandparents around as well, that this is just so different to how their baby was weaned. Again, it's managing their stress and anxiety around it. And they often come on my first aid courses. I have first aid courses in person, but also in people's homes, and then ones online that people can go back to time and time again for reassurance.
Yeah.
So if you really think they're choking, so you think they're not making any noise, either you've walked in and found them playing on the floor and you think they've put something in their mouth, or they've been in the high chair sitting at the table and you really honestly think that they're choking on something, what you initially notice is their panic. You'll see their arms and legs flap. You'll see their eyes sort of pop out of their head. Their face will go very red. And again, they're trying, but they're not able to make any noise, trying to cough, and it's just not working. One of the really key important things, as much as possible, is to try to stay calm, because they are looking to you to save the day. And if you're completely freaking out and panicking, of course, that is going to increase their, them trying to breathe and all the rest of it. And the key thing is really they're not at that point taking in the oxygen that you would like them to. So you'll have done all the patting on the back. We're not going to practice that because people can do that standing on their head. And I'm going to move the camera a little bit so you can see me here. So what you would do is you put your thumb and your index finger around their jaw, okay? Because we don't want the head flopping all over the place. This is for babies up to 1. And you would place them over your lap, okay? So you place them downwards. We keep going back until you can see me properly. You place the heel of your hand around the shoulder blades, okay? So they're tilted downwards like this. And you come down and you do what we call a back slap. And then you're going to look and check to see if it's come out. And do another one. And we do up to 5 of these, okay? Hopefully, 1 or 2 will work. You'll see the object come out on the floor, or they'll make a noise, and that's when you know that the object has come out, because they're able to cry or make that noise. If that hasn't worked, and it's really unlikely that 1 or 2 back slaps wouldn't work, you turn them onto their back, you put 2 fingers up towards the face, and you press down on the chest. I'll just show you where that is. It's just kind of basically in between the nipples, just slightly down in the center of the chest, and you press down. You're cradling the back of the head, so the head isn't flopping all over the place. And again, they're on a tilt. So you do that up to 5 times. If that didn't work, you go back to doing 5 back slaps. If that didn't work, you do the 5 chest thrusts. So you keep doing those cycles. Very, very unlikely. I'm going to have to say, in all of my years of doing this work, I have never, ever known the chest thrusts need to be used. The back slaps are so effective. So they really, really do work. And if for any reason those continuous cycles weren't working, eventually they would get so exhausted, they go quite grey, blue, pale, and you'd need to think about the Dr. ABC technique, resuscitation, if they're losing consciousness. That would be very, very rare, but that's the sequence of events. And for children that are above 1 is the Resuscitation Council's guideline. It's really that they need to be able to stand on their feet. So if at 1 they still can't stand on their feet unaided, then you would do what we've just done, taken their own weight. But otherwise, then you move on to doing back slaps, just the same with them standing. So if it's a toddler, you're kneeling. And if it's an older child, you're standing and they're standing. Same for adults. And then you rotate between back slaps and abdominal thrusts, which is basically the Heimlich maneuver that we've known over the years. I haven't got the bigger dummy, sorry, to demonstrate. But important for weaning at the early stages is what I've just shown, to feel confident with that. It's really good to watch it, to see it. It's even better if you get to practice yourself in a first aid course. But really, you do need that reassurance. I can see a mile off when parents are just thinking, wow, I'm so nervous about hearing gagging or introducing any lumps, or finger foods is scaring them. It's really important because babies tend to love finger foods. To eat particularly a huge amount from the finger food initially. They'll just kind of chew it, lick it, suck it, drop it on the floor. But it helps their enjoyment. And even when you're spoon feeding, you want to have always at least 3 spoons at every meal, because they'll get really frustrated if you're just trying to neatly spoon feed them. Did you want me to touch on allergies at all?
Yeah, I mean, I know we haven't got loads of time. It'd be great to, just give a bit of insight. But I was just going to ask quickly on the choking, particularly. If the one thing that confused me a little bit was about having the straps on a
Yes,
baby. Then
really.
I was quite like, I don't want the mess everywhere. I had to get used to it in the end. But right at the beginning, then you've got the kind of what are they called, like overall or bib over the top that might have sleeves on and everything as well. So what would you recommend for that if you want to get baby out quickly to
So
do that on
seen,
them?
I was sent one actually. I've seen a bib that actually goes over the tray of the high chair, which kind of, they just lift up all the mess, as it were. I think things like that aren't the best idea for knowing that, you want to be able to get them out quickly.
Mm-hmm.
Saying all my years of doing this that I have not seen, I've seen more accidents where parents haven't strapped them in and they've either stood up when they've, their back turned, or they've come out of the high chair and obviously then sustained a head injury, other injury, than any risk of them being strapped in case of choking. It's much safer to have them strapped in, and it takes literally a couple of seconds to unclip them. Than to not strap them in. And in terms of bibs, I mean, the ones that have the sleeves, they're either plastic that you wipe or you put them in the machine, or the Pelican bibs, they're all totally fine. They're not going to hinder you in any way in terms of needing to do any of this, or just kind of gently pat them on the back or anything like that. But I think, again, it's all these different products out there. It can be really confusing for parents.
Yeah, no, thank you for that, because it can feel like you're kind of strapping them right in, but like you say, the whole having an accident of them coming out
Yeah.
would be...
You can so easily get a false sense of security that they're kind of in the chair,
Yes.
but quick. They're very quick. So once they get able to stand or move, do something they haven't before, they just take you by surprise.
Yes. Thank you. So yes, let's move on to allergies.
Yeah, so allergies have become a really hot topic. I don't think our parents would have barely ever spoken about allergies. And we do know that kind of day-to-day allergies have increased, the ones that just unfortunately make life a little bit more difficult. So that cause itching or a bit of swelling. Excuse me, I can feel that.
Bless you. Yeah.
So ones that just cause things that just do hinder life. So yeah, eye swelling, eye watering, itching, hives, that kind of stuff. We do know that the actual life-threatening anaphylaxis allergies haven't increased, and they really generally only affect a small percentage of the population. But obviously they cause a lot of panic. And usually a significant anaphylaxis, which is your worst case allergic reaction, where it causes the airways to start to close, swelling, the blood pressure starts to drop, the airways start to close in response to the body's immune system recognizes something as a threat. You're going to see that happen, because you're going to see the difficulty in breathing, and generally you see the swelling then outside as well. So eyes, lips, things swelling, and people can, hopefully get help very, very quickly for that. I do say to parents where they have significant allergy themselves to talk to the GP. Fortunately, GPs aren't always the most keen to do this, but they can prescribe a dose of antihistamine so that parents can have that ready in their home. You can buy it over the counter from the age of 1, but when the babies are small and starting these foods like the egg and the shellfish and the nuts and that kind of stuff, you can't just buy it over the counter. It needs to be prescribed on their weight. So something like this, like the Piriton. And GPs can prescribe it on their weight. So if parents have got significant allergy, I would always say, just know what that dose is and have it in the house, just for your own reassurance, and hopefully you won't need it. And I think it's better to have the attitude that hopefully babies haven't got allergies than avoid introducing foods, because actually we know that can increase the risk of an intolerance if you avoid certain foods. And these foods can be, introduced in a very gentle way. So a tiny little bit of scrambled egg, a tiny little bit of smear of nut butter, a little bit maybe in porridge or yogurt or in a piece of toast, or you could put like some milled ground almonds, something like that, into porridge or yogurt. So it can be done very, very gently and slowly. And actually these are often your quick wins as parents. Scrambled egg on toast, nut butter on toast, dipping cucumber batons or whatever it may be into nut butter. They are really good, nutritious, easy meals. So hopefully, as you kind of get past those initial few days of weaning with a little bit of veg or whatever, when you start to introduce the protein, a bit of chicken or whatever it may be, you can start to introduce a little bit of egg and those nuts as well, just really slowly. And, hopefully it will be absolutely fine. But again, it's another one that's been really kind of blown up and can be quite anxiety inducing for parents. The first sign of any kind of real significant allergy that you're worried about, of course, if you do have the dose of antihistamine, you can give it, but otherwise, and as well, they would need to go to hospitals. So whether you need to call an ambulance or get there safely yourself. But if it's just a bit of redness, nothing, the baby's absolutely fine in their high chair, nothing else that you can see, it's possibly just the first time your baby's had that food and the body's reacted in that way, but actually it's not an allergy. It's just as they get used to it, have it more times, it doesn't happen anymore. So we don't ideally want our kids to have allergies. So it's just kind of seeing how it goes each time.
So things like as well, like their nappies, if that becomes, would that be a sign as well that maybe it hasn't agreed with?
So yeah, I mean, it wouldn't be necessarily an allergic reaction. Obviously, there can be intolerances. Like I say, dairy intolerance is quite different to an allergy where, you're getting all the difficulty in breathing and the swelling. Yeah, I mean, you can definitely see signs where, they might vomit, or so less significant allergy, they might vomit or they might have a tummy ache or something like that. But that tends to be, you notice that a bit more over time, because unfortunately they can't talk to you.
No, if only they could. That's incredibly helpful and such a good start of 10, and your resources are amazing for people to go and do it in much more detail with you. So we'll make sure we put those links below. Is there anything else you'd just kind of like to share to close this off and finish us off?
I think sometimes it is one of those, allergies and the choking are definitely, they're real fear factors for parents. I really would say knowledge is power. So I really would say, like, no question's a silly question. Get your first aid under your belt. Get really, really good weaning support. I'm noticing parents aren't necessarily doing a weaning course in preparation for weaning. And that has made a huge difference. People are using apps, or they're using, as they always have done, books, asking WhatsApp groups. And that's great. But ultimately, everybody's weaning journey will be different. And I think if you've got the knowledge to then make decisions about how things are going, you're not going to know how your baby's going to be. Some take really quite a while to get going with it. Others wolf it down, like different things. I think you need the foundation yourself. So I would really urge parents to get that support. Do a weaning course in preparation. First aid course. It's a great time to do a first aid course with them getting mobile in the next few months as well. Safe proofing, all of that kind of stuff. And we do cover all of that. They're specifically for parents.
Yeah.
But if you've got a local first aid course you can go along to, just get that knowledge and that confidence for sure. It's a really, really essential foundation. Yeah,
it is. And it's one of those, you could do it. It's good for everyone who's going to be with your baby, or
definitely. And I know people get quite a lot of, it's a bit tricky sometimes with grandparents that are desperate to see their children get a bit more sleep at this point as well. A few months in, parents are so tired and they're saying, give them a rusk, or, put a rusk in a bottle, or these things that were commonplace a few decades ago but aren't now. Baby rice, all this kind of stuff, we know differently now. And although those products are still on the shelves, which is again confusing, we know that just really adapting your family food right from the beginning with a bit of veg and then introducing proteins and things, you can do that. And then also parents sometimes are not used to cooking. They're used to having been working and grabbing something on the way home, or eating out, or getting a takeaway, and that can feel really, really overwhelming. I would always say to parents, just plan 3 meals for the week. Those can be used as leftovers. Put stuff in the freezer. Just keep it simple: a tray bake, a stew, bits from a roast. It doesn't need to be like, a sort of elaborate recipe at all. One night scrambled egg and avocado, brilliant. Keep it really, really simple. But just a little bit of food prep helps as well.
I'm going to take that for me. 3 meals. That's what I need to do.
I take it for myself right at the moment. Tell you. And the freezer is your friend. Your future self is so grateful.
Yes. Oh yeah. Thank you, Katherine.
It was a pleasure.
Pop that on now and have a lovely rest of your day and your week as well.
Thanks very much. Bye.
Bye. Bye.